First off, excuse me, I'm a little sick right now, but here we go. The COVID-19 pandemic era pushed in a whole new set of challenges for youth in the United States, leading to a mental health crisis as declared by the United States Surgeon General. But U.S. children and teens have been suffering for far too long. In the 10 years leading up to the pandemic, feelings of persistent sadness and hopelessness, as well as suicidal thoughts and behaviors, increased by about 40% among youth people, according to the Centers for Disease Control and Preventions. We're seeing really high rates of suicide and depression, and this has been going on for far too long, said psychologist Kimberly Hogwood, PhD, a professor of child and adolescent psychiatry at New York University's Grossman School of Medicine. It certainly got worse during the pandemic. In addition to the social isolation and academic disruption nearly all children and teens faced. Many also lost caregivers to COVID-19, had a parent lose their job, or were victims of physical or emotional abuse at home. All these difficulties, on top of growing concerns about social media, mass violence, natural disasters, climate change, and political polarization, not to mention the normal ups and downs of childhood and adolescence, can feel insurmountable for those who work with kids. The idea of mental health crisis is really broad. For providers and parents, the term can be very anxiety-provoking, said Melissa Briarwood, who directs Terrorism and Disaster Program at UCLA, Duke University, National Center for Child Traumatic Stress. Part of our role is to highlight specific areas that are critical for discussion. Across the field, psychologists are doing just that. In addition to studying biological, social, and structural contributors to the current situation, they're developing and dismantling solutions to families and schools and at the state level. Psychologists were also behind new mental health recommendations from the U.S. Preventative Service Task Force, a group of volunteer health professionals who evaluate evidence on various preventative health services. The task force now recommended regular anxiety screenings for youth ages 8 to 18 and regular depression screenings to adolescents ages 12 to 18. I see these trends in children mental health problems as being critical, but there are solutions, Hogwood said. If we refocus our efforts toward these solutions, we could see some of these tides turn. Across the United States, more than 200,000 children lost parents or caregivers during COVID-19. In the face of those losses, families had to curtail mourning rituals and goodbye traditions because of social distancing requirements and other public health measures. Sometimes while facing added challenges such as moving to a different school or transferring to a new school with unfamiliar peers.